little bit of background about myself. As I mentioned earlier, we've been here for about 22 years. My background before that, I have a degree in healthcare administration. My father was a physician. I was raised around, medical issues. Cancer research at UCLA that I volunteered for. My father was able to get me inside of that. He was also a professor there. I worked at the Hospital of the Stars, which if you know anything about Los Angeles and the Westwood area, it's called St. John's Hospital, also Mount Sinai Hospital. They had the type of people like Bing Crosby and John Wayne and those people. Ronald Reagan, before he was a president or even a governor, that's where they would go. And very well funded. Has anyone been had a bit of supplies, things, mailers come into your home?
Yeah.
Okay. Yeah. It just, you think of the trees that have been butchered. Well, what has happened is that I've been in healthcare, as I mentioned. I ran and operated nursing facilities, got a degree in healthcare administration, home health agencies, and so forth. When I came over here, I started working with individuals, small businesses, providing their group coverage, Kaiser, Providence, Regis Blue Cross. And then as I have aged, it's not quite as thick as it used to be, and my clients have aged, I started having employees and employers say, please help Joe. Joe would come in and say, hey, what's going on with Medicare? We would go through, they'd bring in stacks of stuff from all the different carriers and go, what is going on? So I began specializing in this several years ago, and then Vancouver Clinic found out what we do and said, hey, could you help our patients that are turning 65 and those that are 65 that are moving into the area and they need help understanding how Medicare functions. And so that's where we put this consolidated program together, this workshop, so that you understand basically how does Medicare function? What does it do? Okay? What are the programs under Medicare overall? I'm not talking about the insurance plan, I'm talking about Medicare, all right? How is it funded? And then how do I plug into it, all right? And so that's what you're going to get. At the very tail end, we will do a comparison of the plans that are accepted, that are preferred plans here at the Vancouver Clinic. Laura also is an advisor. She does these workshops also, so if I'm not available and people want to follow up afterwards, which, by the way, if you do want to talk to us, and it's important that you sit down with us, or you have some personal questions and that you want a little bit more information, please put on there, appointment at the bottom, and we will be sure to follow up with a phone call. Okay? Good? All right. So, how does Medicare function? What is it made up of, the components of Medicare? Medicare was structured and came online back in 1965, and it has 4 different components or parts. A and B is called the basic or traditional portion of Medicare. And A and B is an insurance program. It can stand alone with nothing else besides it, okay? The problem is, are the doctors going to take it, okay? And really when you're going to hear this, I'm going to say this over and over. What's so important is access. Whatever plan you have, you want to have a plan that's going to provide you the broadest form of access. Access to the doctors in the area that you happen to live. Has anyone heard of people who have been having difficulty finding a doctor? Okay? All right, we do know this, and it is out there. And I'm going to give you a reason why. And you've all heard this adage, follow the money. Well, we'll be talking about following the money, and healthcare does involve money. That's why people want to fill these holes, and they call that filler is Medigap or Medicare supplement, right? That's what they do. They purchase that Medigap or Medicare supplement by different private carriers throughout the United States. These type of plans, it goes from A to L, they call them alphabet plans. There's about 12 or 13 of them. They're standardized. There's no difference in these plans that are offered through AARP or Regis or Mutual Omaha or Aetna. All those plans are standardized throughout the United States. You can't sell anything different. The only thing that could possibly be different between those plans is the premium, period. That's it, okay? So, people buy the plan that they think is going to be good for them, they can afford, that fits in their budget, and it's, like an F plan is a very popular, it's a very good plan, provides great coverage, okay? It's very comprehensive, it fills all the gaps, you have hardly anything at all out of pocket in that F plan plus your traditional, and guess what? It's not accepted by most doctors in the area. okay? And you go, well, great, you've told me about how to have this great plan. I have the A and B, and now I have the supplement. Now you tell me I don't have access. But I first want to cover Part C. Part C I haven't talked about, have I? I talked about A and B and D. What is C? C is you first have to have A and B, okay? If you have A and B, then you can sign up for Part C. Part C is called Medicare Advantage. This slide here is probably going to help you understand more than any other slide I go over today how this program functions. Because I talk to people who've been under Medicare and they're 90 years old, seriously, and since it started. And they don't understand that there are Medicare Advantage plans and that there are Medicare supplement plans, and they are different. They're totally different, all right? And so let me expound a little bit on how the difference is. What happens over here on this side is, as you see, A and B are hospital benefits, your physician outpatient services, your prescription benefit, and your Medigap coverage. So a person has the basic A, B, they fill the gap, they add the prescription on top of it. So what happens under this Part C? Part C, you have your hospital benefits, you have your physician services, you have your prescription coverage. You may even have additional programs in these plans. For example, Regents also has vision and dental, which is not included over on this side over here. Okay? Worldwide coverage, which may not be over on this side over here. So there can be some other additional bells and whistles that may be an advantage to you. So there are basically two different programs under Medicare. It's like when my wife says, go get some fruit. And I go and I get some fruit, and I come back with some apples. She said, I meant oranges. Well, how do I know? It's fruit, okay? So there are definitely two different programs under Medicare. There's a Medicare Traditional with a Medigap policy, and there's a Medicare Advantage. In fact, I want you to write this down. You can write on the back of these little cheat sheet cards, there's colorful cards there, write down the term Medicare Advantage. And the reason I'm saying this is because these are the plans that are predominantly most accepted in the Portland metro area. So if I was going to advise anybody, I always tell them, first call your physician, your clinic, which we know the Vancouver clinic here, and ask them what are the plans they prefer and take. Because what's the point of you signing up for a plan that they don't take?